This is a message for all my fellow L&D nurses, OBGYNs, midwives, anyone who works in the maternal health care area. I want you to ask yourself, when's the last time you asked your patient if it was okay for you to examine them? This is something that I don't see every provider do, and this is something that should be done with every single person. I understand that we do this is our job, we do it every day, but for the patient and for the woman on the other side, that this is not something that they do every day. A stranger inserting their fingers into them, this is a very personal experience, and I have definitely seen providers who have not asked permission and gotten consent prior to examining their patient, and this needs to change. I always ask my patient if they would like me to check them. And this is something that I kind of give them the reins and they're in the driver's seat and they can decide, is it time for me to be checked or is it not time for me to be checked? And am I okay with someone else checking me? Of course, there's situations where being examined is an emergency situation, but you still have to provide informed consent and realize that these patients might not understand why it's such an emergency. And you have to explain and say, right now your baby's heart rate's really low, so I would really strongly recommend that we check you to see if you are fully dilated. So next time you are going to examine your patient, make sure you are double checking that you or the person you're with in the room is asking for informed consent prior to a vaginal exam. If you are the patient and you are the person on this end and you feel like your provider isn't listening to you or isn't providing you with enough information, stand up for yourself, advocate for yourself. It is okay to do that.